Posterior tibial tendonitis is a fairly common condition that involves the major supporting tendon for your arch. And posterior tibial tendonitis is one of the major causes of flat feet that develop after having a fairly normal arch later in life. PT tendonitis is a condition that is associated with pain, and you know you have this if you notice, and I'll show you on the model, if you notice that you're developing swelling along the inside of your ankle, and often you've had a prior flat foot, or you're starting to notice that the foot is starting to develop into a flat foot and it tends to rotate outward. If any of these signs or symptoms develop, you may suspect that you have a condition that is related to or is posterior tibialis tendonitis. This is a condition where the tendon that supports the arch starts to fail. That tendon becomes stretched, becomes diseased, and it usually starts with swelling and fluid around the tendon, and then gradually that tendon starts to thicken and then it starts to stretch. The process is painful. Pain initially is in the inside of the ankle, and then over time the foot starts to deform, and as it turns and rotates outward, then you get pain on the outside of the ankle that is related to the bones being close in contact to one another on that area. Posterior tibial tendonitis is treatable at home initially by reducing the activity that might have caused the symptom, and in many cases just using an over-the-counter insert in your shoe or orthotic can be helpful. The FootMind orthotics have a flat foot orthotic or a posterior tibial support orthotic that's really helpful for this, and there are several manufacturers that also use some type of an insert or create an insert that can help with supporting the inside of the foot. Other home remedies can be the use of an ankle brace. A sports brace can help support the ankle, and then in addition to that, use of anti-inflammatory medications like Motrin or naproxen or ibuprofen or Aleve can be helpful in reducing pain and swelling around the ankle when this occurs. And then using a supportive, neutral shoe can also be helpful. If this fails, then you should see your foot doctor, and I would suggest within usually about 8 weeks of symptoms where there's swelling that isn't resolving or pain not resolving on the inside of your ankle or foot, you should definitely have this checked. Your foot doctor will then examine your foot, make the diagnosis through the use of the exam and also x-rays to be able to determine whether you have this condition, and then will initially sometimes put you in a cast or a fracture walker boot to immobilize the ankle, and then if not effective, or if effective, may consider using an orthotic device. Some of these orthotic devices might be just an insert in your shoe, similar to the FootMind orthotic, or maybe a custom orthotic that's designed to help tilt the foot. And then some of the other ones can also be a brace that has more of a cupping effect on the heel, and that may even go up all the way up your leg to the knee to give more additional support. And it all depends on how much deformity your foot has as to which of these braces is going to be most effective for you. If these are not effective, then the final stage of treatment for posterior tibialis tendonitis is surgery. And surgery for this can be very effective if done properly, but usually requires a fairly extensive operation. In most cases, we'll do a tendon transfer where we'll take a tendon from your little toes, bring it around and connect it to the bone on the inside of your ankle, and use it to take the place of the tendon that has failed. In addition, we'll then shape the foot back into a neutral position by making a cut in the heel bone and shifting it inward so it comes toward the inside of the foot rather than being tilted to the outside. And then in addition to that, we'll often do some type of a cut in one of the bones in the middle of the arch to flex it down and to create more of an arch in that area. Usually this requires several months of healing time, but usually no weight bearing on the foot for about the first 6 weeks. Surgery is effective, again, somewhere between about 80 and 95% of the time, depending upon the way this has been studied in the literature, and can be a good long-term solution. Sometimes fusions might be required, and if this is allowed to progress significantly, then it can even cause problems in the ankle joint itself. So treatment is really something that should be pursued if you start noticing some of these sequential symptoms we've discussed.